Everyone. Welcome to this session, Career Opportunities, Nursing and Midwifery. Today we have a special guest from NSW Far West Local Health District, Corey, with us. I'm Tasfia Miti. I'm industry consultant for the Career Center here. Before I start this session, I would like to acknowledge that the Charles Darwin University acknowledges all First Nations people across the lands on which we live and work, and we pay our respects to elders, both past, present, and emerging. I'll just quickly go through what my key role is. I connect students and grads with opportunities. I manage and coordinate employer and graduate in program information info sessions, and we have got jobs board. We have Facebook platform as well, where we promote opportunities and events like this. This session is basically a part of our Insights to Industry programs, where we aim to help students understand the career options and how to be successful in securing roles in the industry. Um, I probably won't speak more today. I will hand over the session to Corey to introduce himself and start presenting. I think Corey will be presenting from um, sharing his screen with the PowerPoint, I guess. Cool. Over to you, Corey.
Thank you for that, and thank you both for attending and anyone who's watching later online. I will be sharing my screen in a second. I'll just give a bit brief background to, I guess, who I am, my role, and the Far West Local Health District. So my name is Corey Slater. I'm the Nurse Manager of Nursing and Midwifery Workforce Leadership and Development for Far West Local Health District. Part of my role is the new graduate program, so Grad Start for New South Wales, but for the local health district of Far West, and also career opportunities for existing staff, and a lot to do with recruitment, retention, all the way from undergraduate students coming through on placement to nurse practitioners and sort of everything in between. A little bit of my background. I have a Master's of Nursing, specialising in acute care. I'm currently undertaking a Master's of Clinical Medicine, specialising in leadership and management. I've worked in these type roles for quite a few years, both domestically and internationally in Papua New Guinea, where I was sent for a COVID deployment and then just sort of went into all these other different roles around new graduate programs and field hospitals and aeromedical stuff. So I've had a bit of experience, I guess, in everything, both working in rural and metropolitan in New South Wales Health as well. So I'll just share my screen and hope I don't break this completely. Can you see that? Is that okay? Awesome. So that is Broken Hill. You can see in the centre that is the Broken Hill Health Service, which we'll get into the nitties and gritties of it there as well. So just I'd also like to make acknowledgement of country. So in the spirit of reconciliation, the Far West Local Health District acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. A little bit about the Far West Local Health District. So you can see we are the Far West, quite literally. We're the second largest LHD in New South Wales Health. We cover around 200,000 square kilometres. So as you can see from the map on the right, that covers all the way from the Queensland border being Tibooburra, all the way down the South Australian border as well, passing through Broken Hill, and then down to Victoria with Wentworth, Denton and Balranald being those border towns. Our population that we cover throughout the district is around 30,000, give or take, and it's got a quite high individuals who identify as Aboriginal or Torres Strait Islander at around 12%. So this sort of goes into a little bit more detail. So we employ approximately 800 staff across the 9 facilities, which you would have seen in the map previously. This includes 6 public health facilities, 2 multi-purpose services and a primary healthcare centre. So Broken Hill is the base hospital of the region and the largest. It fluctuates from around 100 to 110 beds, depending with winter surge capacity and stuff like that. We work quite closely with, for example, the Royal Flying Doctors Service and the Aboriginal health services like Marymount and Killa Health throughout the region, and other NGOs like SES and St John Ambulance New South Wales when needed. Any super specialist care that we need to provide, we do in a timely state and then try and get people out to tertiary referral centres because Broken Hill is the base hospital but not a tertiary referral centre. Being so close to Adelaide that we run on Adelaide time, they usually go to the Royal Adelaide Hospital through, for example, the RFDS. So to get into the different sites that we do have within the district where our new grad program consists of. So Balranald, you can see, is the furthest at the bottom of the map, being right on the Victorian border. It's a multi-purpose service with 24-hour emergency and hospital services. It does have a residential aged care there as well, like many of those remote sites throughout the district, and a range of primary and allied health services as well. Later on, I will show a map which makes a lot more sense of how the new grad roster works. Basically, each line within the roster has 4 rotations at 3 months, Balranald being one of these rotations for some of the lines. That will make a lot more sense when I show you on the map later on, though. So generally, we have three new grad placements here over 3 months. And we have a district clinical nurse educator for new graduate support. And we are in the process of having another one come on board. So there'll be 2 clinical nurse educators just dedicated to new graduate support throughout the region, as well as the district CNS2s in education, which travel between the remote health sites. And we run telehealth and teleeducation from Broken Hill for these sites as well, not just for the new graduates, but for the other staff as well, for nursing midwifery. This goes into a little bit more of the Balranald services. So as you can see, it's quite a few different services, not as much as the Broken Hill Base Hospital, but enough to be quite a large multi-purpose service. So the base hospital, Broken Hill, the hub or the centre, I guess. So it is a 98-bed, give or take, rural teaching hospital, offering a wide variety of services, including 24-hour emergency, and our maternity services are majoritarily based here as well. Generally, we have 16 3-month new graduate placements here. So a lot of our new grads at any given time throughout the breakdown of the rotations are based at Broken Hill. Here we have multiple clinical nurse educators for their varied specialty areas and departments, as well as the dedicated clinical nurse educator for new graduate support, both of them. So when Lauren comes on as well, she will be both based here, but they take turns at going out into the district and basing themselves from those sites as well, just to ensure there is that education and professional support and that personal support that they offer just to the new graduate cohort, because we understand that new grad year can be hard and difficult, and we want to be able to help you through that in a professional manner. So I won't list all the services, but there's a lot of them. If there's not the services out in the district sites, then it's most likely at Broken Hill. And we've got transport services where people can come into Broken Hill and vice versa, and we'll assist our consumers with that. So the Broken Hill Community Health Centre, I'm based upstairs. So this is where some of the offices are upstairs, and downstairs is where the Community Health Centre is. Offers various child, youth and family health services. So generally we have 2 3-month new graduate placements here, being in community with aspects of the child and family health as well. But a majority of these are just based in the community outreach for Broken Hill. Other services that we do offer here is early parenting support, immunisation, a lot of those primary health aspects, social work, sexual health, women's health and violence, abuse and neglect, where people can come and have these services, as well as dental, like stuff like that as well. So Baronga Health 1, again, down to the bottom of the map. So this is quite a new facility caring for the Baronga, Denton, Golgol, Wentworth, Houston and Balranald communities. So how this centre works is it's more of like a community health centre like in Broken Hill, offering those outreach primary health services, as well as specialty services around maternity, newborns, aged care, sort of those different niche areas, diabetes and stuff like that as well. So as you can see here, lists all of the different services. We did have a new graduate rotation here. This year we haven't gone ahead with that, but likely next year we may be starting that again for 2024, which is exciting. The Far West Mental Health Recovery Centre. So this centre offers day programs and 6-week residential stays. The Recovery Centre is a 10-bedroom facility that provides mental health support and coaching. So this is completed by referral, or it can also be direct admissions. Generally, we don't have new grad rotations here, although watch this space in the future. We could be expanding into that, especially with our expansion of mental health services across the district, which is really exciting. So Ivanhoe. So we've gone the far east of the far west. The Ivanhoe Health Service provides the on-call emergency and a range of primary health care and outpatient services. So interestingly enough, Ivanhoe, Tibooburra, White Cliffs, Wilcannia, Menindee, and that is it, run the ambulance service. So because they're quite small towns, rural and remote, the nurses who are working in these facilities, obviously senior with specialised training, do actually run the ambulance service with the New South Wales Health Ambulance. So we don't have paramedics in these towns. They are the paramedics and the nurses. So I guess the care starts from the curbside, not just the bedside, which is a really interesting opportunity for new graduates to be a part of. As a new graduate, you will not be by yourself leading this on-call emergency or anything like that. You will be part of aspects of this, but in a safe and structured way, with specific learning and development and stuff around that. So you'll always be based with a senior or two who have been doing it for a very long time, and you'll be able to observe safely and learn a lot, which is it's an amazing opportunity. So generally have 1 3-month new graduate placement here because it is quite a small health service, and that's the same with Tibooburra as well. So we generally try and get some of our grads out there, but obviously we can't get all of them just because of the staffing arrangements. So the services offered are listed here. The remote health service sites are quite similar in the services that they offer because it is tailored to the communities around, which generally need these sort of type services in the rural and remote areas, and then with the option of sending people to Broken Hill for anything more specific or specialised. Menindee Health Service, so provides on-call emergency and a range of primary health care and outpatient services as well. So generally we have the 1 3-month new graduate placement here as part of that rotation roster. Again, here's some of the services. You can see it's a little bit more green down there compared to some of the other orangey, sandy sites. Tibooburra, so right up the top near the Queensland border and Cameron's Corner, provides on-call emergency and regular primary and allied healthcare clinics. So generally we have 1 3-month new graduate placement here as well. All of these sites have accommodation provided. So it's not like as a new graduate, you have to go and source accommodation for 3 months or 6 months. While you're out there, you can utilize the hospital accommodation, which is usually on site or very, very close by. And a majority of these sites offer it free as well. So it's a good chance to be able to save while you're doing this, especially with some of the on-call rotation rosters that you'll be completing with a lot of senior nurses. So here's one of the ambulances as well. You can see it's the stock standard New South Wales ambulance. It's got to be 4-wheel drive because of some of the areas it has to go into. And you can see some of the services here as well mirror the other remote health service sites like Ivanhoe. So Wentworth is a small rural hospital and health service that provides 24-hour nurse-led first aid services and post-acute inpatient care. Wentworth, excitingly, is also going under a redevelopment where they will be having a small emergency department there to take some of the strain off Mildura, for example, which is just over the border. Generally, we have 2 3-month new graduate placements here, but again, that could be expanding once we have the small ED as part of this health service down there. Although it won't be running the ambulance service because that will be run through Victoria, an agreement MOU between the 2 states. Some of the other services here, you can see it is a bit more green than, for example, Tibooburra as well, which changes between the sites. White Cliffs Health Service, probably one of the smaller health services among all of them, does provide on-call emergency and regular primary healthcare clinics, although because it is probably one of the smallest, we don't currently have new graduate placements here. Just because there's no new graduate placements, though, doesn't stop individuals from staying on with us after new grad or coming in once they've completed a grad and a few years experience and applying for positions within some of our sites, and we have vacancies. So some of the services available, very similar to the other health sites as well. Wilcannia Multipurpose Service provides a hospital with 24-hour emergency and various primary healthcare and allied health services. Generally, we do have 3-month new graduate placements here as well. Some of the other services. So this makes a little bit more sense now with the grad program. So you can see how it's split. So our 6 months, our critical care rotations are generally 6 months. So that includes ED and ICU. All of the other rotations, for example, at Broken Hill being surgical, medical, pediatrics, are 3 months. And then the same with the remote health service sites as well. So it can be a mix, for example, like the top line being ED for the first 6 months, and then Wentworth, and then medical. We try to make it that it is a range of different experiences through your new graduate year. So you do get a bit of a taste of everything, and you can sort of decide what you want to go into as a second year as your transition to specialty practice. We do have some rural metro exchange programs as well. So rural being Menindee, for example, you can see about halfway down the page, first 6 months there, and then the second 6 months in ED at Sydney and Sydney Eye Hospital as part of the Southeastern Local Health District. That's a new RMX that we have that we want to keep expanding, maybe with Prince of Wales soon as well. We have some with Gosford and Central Coast Local Health District, so that being ICU, surgical and medical. So you can see if someone applies for that program through Grad Start, they can either start with us for their 6 months or they start in Central Coast and then they swap over. So you get that rural and metro experience. It's quite a good program. We've had a lot of positive feedback from it. Mental health inpatient unit and mental health drug and alcohol for community in Broken Hill are 6-month rotations as well. We have one rotation in operating theatres, which is 12 months, but within that 12 months, they go through all the different roles. So scrub, scout, all the different things that encompass in our OT. And then we have our one grad start midwifery position as well in the maternity unit of Broken Hill. So this is sort of how it works. This is an older version. This looks different for next year already, but it's the same sort of foundations and basis of critical care being 6 months, the other ones being 12 months, and then the others being the 3 months with the rotations and swaps. So applications for Grad Start New South Wales for this year for all of the districts, including Far West, they have shut. So everyone's put in all their applications and that's all finished. Although us as a district, we do direct entry and admission into our program. So we put forward a certain amount of numbers and then we have a certain amount of other numbers for our direct applications. For further information around that, I'm happy and can discuss on an individual basis, preferences, all of that different stuff. And we run our own recruitment on those side of things. So we have an interview, we do reference checks, all the stock standard stuff. I will get into some interview tips and tricks as well, which may be handy. But yeah, that's basically how it works for the graduate programs in New South Wales. So the tips and tricks, I guess in your answers, be clear and speak with, I guess, intention and purpose. Really try to use examples. So what I love to utilize in, for example, my own interviews over the past years and what I look for in when I'm interviewing people is giving star responses. So if you don't know what that is, look it up, memorize it. It's really good. It's basically walking someone through an example of what you're giving them. So they ask you a question around when's the time you had a patient that you found was difficult to manage because of X, Y, and Z, and you can go through giving them an exact example, even if the question isn't as direct as that, and they go, what personal and professional qualities do you bring to the role? give them examples. Give them examples of personal qualities that you've utilized in a time on placement or with friends or whatever, and then the same with the professional. I guess also if you've worked as an undergraduate AIN, assistant nursing or assistant midwifery, or an enrolled nurse, or anything that you've had experience in that sector, draw upon that in your examples that you give and your answers that you give. It shows your breadth of experience. It shows why you deserve the job, and how you will be very efficient first coming into the role and learning in the role and all of that as well. Do your research on the position and the district. There's nothing worse than sometimes when I conduct interviews and people go to me, oh, so Broken Hill's an hour away from Sydney. And I go, it's a little bit longer than that. It's about 13 driving. So make sure you know where you're applying for, and a little bit about the district as well always helps, and the position. So obviously it's a new graduate nursing position, for example. Just do your research. If you can find, for example, on one of the ads, a position description, it's always handy to see what they're exactly looking for, and you can address some of that in your interview. That will get you really good marks. Work on how to present your background and experience. So I guess in my examples using STAR, draw upon certain aspects of your experience that stand out to you. So was there a patient that you dealt with as a student that you'll really remember because of X, Y, and Z? Is that something you can utilize in any question that's thrown at you? Can you make that work with any sort of theme of a question? Highlight them, try to remember them, and you can keep them, I guess, in your arsenal for you to utilize. And then emphasize the skills and lessons that you've learned over the years. A willingness to work and learn is always positive as well. And bring a pen and paper. It's always helpful to just quickly jot something down if you need to. There's no harm in asking for someone to repeat a question, or if you want more clarity around the question as well. Always try to ask the interviewer a question at the end. When they say, do you have any questions? Just yes is always a good answer. More about the role, learning and development opportunities. It shows the interviewer or the panel that you are really keen for the position. So rural sites, so I guess some positives around it. For example, within the Far West, for a new graduate program, there's usually a small number of new graduates compared to, for example, metro sites or other sites, with a large number of resources compared to the number of actual participants. There is more autonomy and accelerated learning and development in a safe manner. There's more, for example, resources in clinical nurse educators dedicated to new graduate support who can work side by side you to really develop your skills in areas that you need and in areas that you want as well. There's a strong sense of community due to the lower population. You find you see people down the street, everyone says hello. Being from the city myself, it can be quite like, why is that person saying hello to me? I don't know them, but you get used to it over time. It's very welcoming and it's very warm, I guess, and positive. There's exceptional career progression opportunities. There's sometimes not as many people around for certain positions. It's a lot more accelerated to go from an RN to a clinical nurse specialist, for example, because there's just more of those opportunities that come along. In some of the other, for example, in metro people, and there's only so many positions. Rural health services, as we've discussed, they do transition to one another, especially in the Far West. So, for example, as a senior nurse in one of the EDs in one of the smaller sites, you are the ambulance response. So you get the call, you go and respond as the ambulance nurse, you pick up the patient, bring them back, you continue treating them in the ED. They may need to be flown out, so you contact RFDS. RFDS start doing all of that. You package the patient, then you're helping put them on a plane to be flown out. That is something you won't get in the city. It is quite rural and remote specific. Those, I guess, not examples, but those situations and those opportunities was the word I was looking for, which can be very, very rewarding. And it's you learn quickly and you gain a lot from it, both personally and professionally. So a little bit about rural nursing pathways in practice. Can be used for all nurses, but importantly, new graduate nurses. So it's a collection of professional development resource designed for all rural nurses to equip and enrich their careers. So we promote this among all of our new graduates to complete even prior to them commencing, just because it allows them to go through all of the theory. And then once they start with us, then they can start utilizing this in practice as well as with their learning and development plans. So I mentioned the dedicated clinical nurse educator for new graduate support. So I guess what do they exactly do? So they participate in orientation programs for new graduate nursing and midwifery staff. They obviously assist new graduate nursing and midwifery staff with their competencies, their learning and development, and how to function in each different healthcare setting, service, and specialty as well, because they are quite different from one another. To support the uptake of the RM PIT program, which I briefly touched on, and to go through those other educational aspects, as well as being a career pathways mentor. So going through your learning and development on an individual contextualized basis, but also having those discussions about, so where do you see yourself in XYZ? What are you interested in? And really starting those discussions early to allow someone to plan and think ahead. That plan may change 100 times, and that's fine. They can answer you 100 different ways if they need to over time. So the Rural Metro Exchange, I've touched on this briefly, but it allows individuals to work in the big city metropolitan areas and then the country rural areas of New South Wales as well. We're looking to expand these more and more, but it's good that we've got around 4 to 5 currently for next year. So the ambulance training. So when you're responding out with the senior nurses on some of the sites, we obviously need to put you through specific training to do so. So the 3-day theoretical and practical training is provided by New South Wales Ambulance. It's very similar to, for example, the St John, New South Wales first responder training. It is unique and it is an incredible opportunity which is not offered in, for example, metro sites. And that frontline care starts at the curbside, not just the bedside. So what it runs through is basic use of some of the equipment, so pelvic binders, proper use of spinal boards, how to properly strap someone into a stretcher, a bit about scene management as well. So rocking up to, for example, a car accident, what you need to do and what processes you need to follow. And obviously communication as well. So using a radio, all of that different stuff. It is quite cool training. And we're looking to expand that over the years as well, especially next year with additional days and additional learning opportunities within it. You can see some more photos from it. So the new grad education days that we have, so with your program, you get 5 education days, ranging from team leader, comprehensive assessment and care, the New South Wales ambulance training, which is a few days, but we call it the 1 day or the 1 study day, the career pathways planning day as well, and then there's new graduate C&E fortnightly education sessions with both theoretical and practical components. So what support do we provide you? So the education department, which I've mentioned, is based in Broken Hill Health Service, and that contains your nurse educators, your clinical nurse educators for all the different specialties, departments and units and wards. We have our senior nurses, we have clinical nurse consultants in different areas ranging from emergency to wounds to infection control. We have a clinical midwifery consultant as well for all things maternal and neonates. Formal and informal mentors that we set you up with, as well as reflective clinical supervision buddies who are trained in giving reflective clinical supervision. And these services between the mentors and those buddies are optional. So we set you up with these people, make initial contact, and then from there you can contact them often, or you could say, I'm fine, I'm doing okay, I'll reach out if need be, that's okay. But we just like to give you the option of both. So the formal and informal mentors are sort of someone you can chat to about majority of different things. If it's personal, if it's living in the region, if it's
Hi, I think Corey's internet. Hello, can't hear you, Corey. Hi, Lindy. Hi, Jonash. Sorry, I think Corey's line got disconnected. He will be right back in. In the meantime, Jonash and Lindy, do you have any question?
And that's what happens working rural and
Oh,
remotely. Sometimes your internet cuts out.
oh, no, that's all
I'm
good.
so sorry. I was
Back
basically
in.
finished. That
Oh,
was basically the end of the presentation.
no problem. Thank you so much, Corey. I would
It's
probably
okay.
Yeah, and I wanted to actually quickly drop a link to the Career Center portal as well for Lindy and Jonash. When Corey was talking about the interview tips, we've got like heaps of online workshops happening from Career Center. I'll send you direct links to register for those online workshops. Zoom links are available when you register, and there are interview workshops, how to prepare your CV, and everything. But thank you so much, Corey, for the session
That's
today.
okay. That's all
And
right. Thank you for having me.
no problem at all. And Lindy, Jonas, do you have any questions today?
Yeah, hi. I just had a question just regarding the rotations that you put
Yeah.
up, the little spreadsheet. Does the graduate get any input into which one they would fall into? So, for instance, I don't really want to go to Wilcannia, but I'd really like to go, to XYZ.
Yeah, so that's I guess the conversation you can have on interview. We will ask
Right.
for preferences and say like where would you like to go, and I guess that's where looking at the district and having this information is helpful, because you can go, well, I really don't want to go to Wilcannia, but I wouldn't mind going to, I don't know, ED for 6 months in Broken Hill and then going to Wentworth and doing that. Is that an option? And that's where we can be as individual as we can.
Okay, thank you.
That's
and
okay.
my other question, sorry, was just you mentioned it in there. I think that there's some of the locations will provide accommodation.
Mhm.
Is that like your old school nursing quarters at the hospital type accommodation, or what is it?
So for Broken Hill, it is the staff quarters. So
Yeah.
it is that sort of old school nursing accommodation.
Yeah.
Whereas for the remote sites, it's more of a apartment, which is furnished and stuff like that. Sometimes it can be some facilities are shared, like the laundry facilities, for example.
Yeah.
But then it's got their own breakout areas and sort of apartments. It's a lot. It's quite nice, a lot of them, because they're quite new and refurbished quite often.
Okay. All right. Thank you. That was all I had.
That's okay.
You
I've put
answered
my
everything
details.
else.
Awesome. I hope so. I'll put my details in the chat as well. If you have any other questions that pops up, that's more than happy for you to contact me.
Great. Thanks, Corey.
That's okay.
Okay, Corey, thank you for this amazing session. And I just
That's
have some
okay.
queries. And like the first one is like in terms of like career progression, that when we are like joining as a new grad, and then in terms of career progression, do you have any like limitations or any further requirements, or on what basis the career progression is done over there?
So career progression from a new grad year, like afterwards.
Yeah, afterwards, like what all the requirements might be there for in terms of career progression from the new grad to like progressing ahead. What will all be the requirements for that?
So I guess there's transition to specialty practice programs. So for example, you really want to go into emergency and you have a 1 6-month rotation in emergency and you go to Wilcannia and one of the other sites. And then for you want to stay on with your second year, we offer postgrad certificates fully subsidized for universities that you can start in your second year. And then we've got a transition to specialty practice program that you with your employment naturally go into. So for the emergency department, that would mean studying, for example, a postgrad certificate in emergency or critical care nursing. And then there's specific milestones that you achieve all the way up to achieving your clinical nurse specialist 1 status. There are like a finite number of those positions. But if you achieve all of what you need to achieve within that to lead up to that position, if we don't have one of them available, then there's other options. So you could go down the clinical nurse educator pathway or a management pathway or a consultant pathway. Obviously, there's like the nursing award over the state means that you need a certain amount of years and qualifications to be able to apply for certain positions. But our transition, especially practice, and then afterwards, the career progression opportunities allows an individual to be able to address those criteria and be able to apply for these positions, not just within our district, but across New South Wales Health as well, and probably interstate, but that gets a little bit more confusing because each state's a little bit different.
But that's great. Okay, that's great. Thank you.
That's okay.
Yeah, that's all from my side. Thank you.
Awesome. Well, if there's anything else, feel free to call me, text me, email me. That's fine.
Yeah, sure.
Amazing. Thank you so much, Lindy, Jonas, and Corey. It was, I love this sort of interactive sessions
It's
when we
good.
all are
Yeah.
participating and connecting with each other. I'm sure
Yeah.
when you receive an email from Lindy and Jonas, you'll be like, yes, I've met them online.
Exactly. Yeah. And that's the beauty of these smaller sessions sometimes as well. And then anyone watching online later on, happy for you guys to reach out as well.
Amazing. Thank you so much. This is probably the end of today's session, and I will send out the recording to all the participants who probably in the Sydney campus couldn't join in for lectures and stuff. So amazing. Thank you so much.
Awesome.
See
Thank
ya.
you. Thanks, guys.
Thank you.
Nice to meet you all. Bye.
Bye.